Historically, in OBGYN, we've been trained in what is pejoratively referred to as bikini medicine: breast health, breast exams, vaginal health, pap smears, pregnancy. If you were to only focus on those body parts, as opposed to treating the woman as a whole system in which those body parts play a role, you're gonna miss the boat a lot of the time.
I was 13 right after my first period, just being in so much pain. I learned to accept it. I didn't think this was anything abnormal. After college, I was diagnosed with endometriosis. Endometriosis is like a spider web and it grows outside the uterus. It can reach your bowel, your lungs even. It can really affect any organ.
There are so many women that say, like, I've been talking to people about these symptoms for the last 10 years and no one's heard me. No one's really put it together that I'm having this GI symptom along with this other pelvic symptom, because there's a lot of diseases like that for women.
So I found Dr. Wong with NYU, and when I met her, we just sat and talked. We weren't even in a doctor's office. She was just really listening to my pain, my lifestyle. No one's really sat down and talked to me like that before.
The first thing doctors need to learn is to listen. Pain is not normal. So if you are experiencing pain, it's really critically important that you find a doctor that will hear you out.
March of 2021, I had my first endo excision with Dr. Wong, and a year later, I conceived naturally. After being told my whole entire life I can't have kids, biggest shock of my life. Was not expecting that whatsoever.
My advice to women, especially in their 20s, 30s, reproductive age, is to really know your body and advocate for yourself, particularly if you know that you have a reproductive disorder like endometriosis or fibroids that impact multiple different aspects of your life.
After my son was born, my endo flares were at the worst they've ever been. I knew I had to take action. I knew I needed to circle back with Dr. Wong. I was at my breaking point asking her to remove my ovaries. Everyone beforehand would literally laugh in my face and tell me I'm crazy, you're too young, there's no way we're taking out your ovaries.
We had the whole conversation about, are we thinking that you should do IVF? Should we bank some embryos? What's the right next step for her? And when should we intervene with surgery?
So I met with Dr. Wong, and she's like, if you want to do this, I'm listening to you and I will do this for you. We did another excision surgery, found more endometriosis on my ovaries, but we removed them.
She kept her uterus. She had some frozen embryos already, so that if she wanted to have another baby, it was completely possible.
Since then, I've been pain-free, like completely pain-free.
She's pregnant at 36 weeks now, which is another amazing thing.
And so that's where the multidisciplinary integrated approach at NYU is so unique.
The advantage of having all of my doctors at NYU is that they're connecting and talking to each other. I just love that they all have a better understanding of what I'm going through.
She's happy. She's living her best life now. We really have to honor their wishes because they know their bodies better than we do.